Perioperative nursing care. Perioperative. The surgeon is responsible for obtaining the consent for surgery. Older clients may need a legal guardian to sign the consent form. Psychiatric clients have a right to refuse treatment until a court has legally determined that they are unable to make decision for themselves. No sedation should be administered to the client before the client signs the consent. The nurse may witness the client's signing of the consent form, but the nurse must be sure that the client has understood the surgeon's explanation of the surgery. The nurse needs to document the witnessing and the signing of the consent form after the client acknowledges understanding the procedure. Review the doctor's prescription regarding the NPO status before surgery. Withhold solid foods and liquids as prescribed to avoid aspiration. Usually 8 to 6 hours. NPO. Withhold solid food and liquid to avoid aspiration. Usually 6 to 8 hours before general anesthesia and for approximately 3 hours before surgery with local anesthesia. Insert an IV line and administer IV fluid if prescribed. IV catheters should be large enough to administer blood products if they are required. Gauge 14, 16, 18, and 19. Administer parenteral nutrition as prescribed. If the client is to have intestinal or abdominal surgery, then an enema, laxative, or both may be prescribed the day or night before surgery. The client should void immediately before surgery. Insert a Foley catheter if prescribed. Foley catheter should be emptied immediately before surgery, and the nurse should document the amount and characteristic of the urine. Clean the surgical site with a mild antiseptic or antibacterial soap the night before surgery. Hair on the head or face, including the eyebrows, should be shaved only if prescribed. Demonstrate the use of patient-controlled analgesia pump if prescribed. Instruct the client to use non-invasive pain relief techniques such as relaxation, distraction techniques, and guided imagery before the pain occurs as soon as the pain is noticed. The nurse should instruct the client not to smoke for at least 24 hours before surgery. Instruct the patient in deep breathing and coughing techniques, use of incentive spirometry, and the importance of performing the techniques post-operatively to prevent the development of pneumonia and atelectasis. Deep breathing and coughing exercises. Instruct the client that a sitting position, usually high Fowler's position, between 65 to 90 degrees, gives the best lung expansion for coughing and deep breathing exercises. Instruct the client to deep breathe 3 times, inhaling through the nostrils and exhaling slowly through pursed lips. Instruct the client that the third breath should be held for 3 seconds and the client should cough deeply 3 times. The client should perform this exercise every 1 to 2 hours. Incentive is spirometry. Instruct the patient to assume a sitting or upright position. Instruct the client to place the mouth tightly around the mouthpiece. Instruct the client to inhale slowly to raise and maintain the flow rate indicator, usually between the 600 and 900 marks on the device. Instruct the patient to hold the breath for 5 seconds and then to exhale through pursed lips. Instruct the client to repeat this procedure 10 times every hour. Leg and foot exercises. Gastrocnemius or calf pumping. Instruct the client to move both ankles by pointing the toes and then down. Quadriceps thigh setting. Instruct the client to press the back of the knees against the bed and to relax the knees. This contracts and relaxes this contracts and relaxes the thigh and calf muscles to prevent thrombus formation. Foot circles. Instruct the client to rotate each foot in a circle. Hip and knee movement. Instruct the patient to flex the knee and thigh and to strengthen the leg, holding the position for 5 seconds before lowering. Hip and knee movement. It's not performed if the patient is having abdominal surgery of the client or if the client has a back problem. Remember, hip and knee movement are not performed if the client is having abdominal surgery or if the client has a back problem. Splinting the incision. If the surgical incision is abdominal or thoracic, instruct the client to place a pillow or one hand with the other hand on top over the incision area. During deep breathing and coughing, the client presses gently against the incisional area to splint or support it. Instruct the client in leg and foot exercises to prevent venous status of blood and to facilitate venous blood return. Inform the client of any invasive devices that may be needed for surgery, such as nasogastric tube, drain, Foley catheter, epidural catheter, or IV or subclavian line. Be alert to the patient's level of anxiety. Answer any question or concern that the client might have. Ensure that the client is wearing an identification bracelet. Assess for allergies, including an allergy to latex. Ensure that informed consent forms have been signed for the operative procedure, any blood transfusion, disposal of a limb, or surgical sterilization procedure. Ensure that a history and physical examination has been completed and documented in the client's record. Ensure that prescribed laboratory results are documented in the client's record. Ensure that electrocardiogram and chest cardiography reports are documented in client's record. Ensure that a blood type, screen, and cross-match are performed and documented in the client's client's record. Remove jewelry, makeup, dentures, hairpins, nail polish, glasses, and prostheses before surgery. Document that valuables have been given to the client's family members or locked in the hospital safe. Document the last time that the client ate or drank. Document that the client voided before surgery. Remember, the client should void immediately right before surgery. Document that the prescribed preoperative medication were given. Monitor and document the client's vital signs. Cultural aspects of perioperative nursing care. Primary language spoken, feelings related to surgery and pain management, expectation, support system, feeling toward self, cultural practices and beliefs. Allow a family member to be present if appropriate. Secure the help of a professional interpreter to communicate with a non-English speaking patient. Use pictures or phrase cards to communicate and assess the non-English speaking client's perception of pain or other feelings. Provide preoperative and postoperative educational materials in the appropriate language. Medical conditions that increase risk during surgery. Bleeding disorders such as thrombocytopenia, hemophilia, diabetes mellitus, chronic pain, heart disease such as recent heart attack, dysrhythmia, heart failure, or peripheral vascular disease, obstructive sleep apnea, upper respiratory infection, liver disease, fever, chronic respiratory disease such as emphysema, bronchitis, or asthma, immunological disorders such as leukemia, infection, or human immunodeficiency virus, AIDS, bone marrow depression, or use of chemotherapy or immunosuppressive agent, use of street drugs. Substances that can affect the client in surgery. Antibiotics. Antibiotics potentiate the action of anesthetic agents. Anticholinergics. Anticholinergics are medication with anticholinergic effects increase the potential for confusion. Anticoagulants. Anticoagulants alter normal clotting factors and increase the risk of hemorrhaging. Aspirin, salicylic acid, and non-steroidal inflammatory drugs are commonly used medication that can alter clotting mechanism. This medication should be discontinued at least 48 hours before surgery. Anticonvulsants. Long-term use of certain anticonvulsants can alter the metabolism of anesthetic agents. Antidepressants may lower the blood pressure during anesthesia. Anti-dysrhythmias medication reduce cardiac contractility and impair cardiac conduction during anesthesia. Antihypertensive medication can interact with anesthetic agent and can cause bradycardia, hypotension, and impaired circulation. Corticosteroids. Corticosteroids cause adrenal atrophy and reduce the ability of the body to withstand stress. Before and during surgery, dosage may be increased temporarily. Diuretics. Diuretics potential electrolyte imbalances after surgery. Herbal substances. Remember, herbal substances can interact with anesthesia and cause a variety of adverse effects. These substances may need to be stopped at a specific time before surgery. During the preoperative period, the client needs to be asked if he or she is taking herbal substance. Insulin. The need for insulin after surgery in a diabetic may be reduced because the client's nutritional intake is decreased, or the need for insulin may be increased because of the stress response and intravenous administration of glucose solution. After administering the preoperative medications, keep the client in bed with the side rails up. Place the call bell next to the client. Instruct the patient not to get out of bed and to call for assistance if needed. Guidelines to eliminating wrongs arriving in the operating room. Guidelines to eliminate wrong site and wrong procedure surgery. The surgeon meets with the client in the preoperative area and uses indelible ink to mark the operative site. In the operating area, the nurse and surgeon ensure and reconfirm that the operative site has been appropriately marked. Just before starting the surgical procedure, a timeout is conducted with all members of the operative team present to identify the appropriate surgical site again. When the doctor arrives in the operating room, the room nurse will verify the identification bracelet and the client's verbal response and will review the client's chart. The patient chart will be checked for completeness and reviewed for informed consent forms, history and physical examination, and allergic reaction information. Doctor's prescription will be verified and implemented. The IV line may be initiated at this time in the preoperative area if prescribed only. The anesthesia team will administer the prescribed anesthesia. Verification of the client and the surgical operative site is critical. Post-operative care. immediate post-operative